Hi, I'm Dr Adrian Pendleton. I'm a consultant rheumatologist in the Belfast Health and Social Care Trust. I'm the clinical lead for rheumatology in the Belfast Health and Social Care Trust. I work in the private sector in the Belfast Rheumatology Clinic, the only rheumatology clinic dedicated for patients with rheumatology problems. I also work in the Ulster Independent Clinic. Finally, I'm an honorary clinical lecturer in Queen's University Belfast with an interest in inflammatory arthritis, gout and giant cell arteritis. I have a passion for science and a love for people, and that combination made me want to become a doctor. Why do they want to become a rheumatologist? Well, that's an interesting story. It started off when I was 8 years of age, and my first memories of being in hospital was visiting my grandfather who had rheumatoid arthritis. At that time, patients were treated with low dose of DMARDs, steroids and prolonged bed rest, up to 8 to 12 weeks at a time. When I was working as a medical student, when it came to my attachment in rheumatology, I already had an interest in rheumatology. And so I read further around rheumatoid arthritis, given my grandfather's condition. Interestingly, at the time, I spoke to one of the registrars in rheumatology, and I told them that I had an interest in rheumatology and becoming a rheumatology consultant. At the time, the registrar said, listen, you got to change your mind because there's not many rheumatology consultants around and it's unlikely you're going to be able to make it. So my passion for rheumatology at the time, plus my dogged determination, made me become a rheumatologist, and here I am. Since I started training in rheumatology nearly 30 years ago, we've been in a golden age of rheumatology. We've seen the development of biologic agents, including the first fully humanized monoclonal antibody for any condition. We now have over 10 biologic agents to choose from. We've moved to an aggressive treat-to-target approach for rheumatoid arthritis, ankylosing spondylitis and psoriatic arthritis. We've seen these conditions move into the realms of low disease activity and remission. We have new treatments for connective tissue diseases such as SLE and scleroderma. We have new treatments for osteoporosis. And indeed, the most common inflammatory arthritis, known as gout, we have moved in the realms of low disease activity and indeed possible cure.